want to introduce you all to Dr. Laura Smelter. Laura is the Director of Training for Christian Health Service Corps. She actually leads a number of courses. I think we gave you a little flyer when you came in of some of the courses that we're doing this year. But she's going to talk to you about international standards for disaster and refugee response this morning. Laura has been all around the world with Samaritan's Purse, and I think now all around the world with us for other things, and has been worked in Nigeria for a couple of years at Egbe Hospital. And so anyway, I'm going to turn it over to Dr. Laura. Thank you for joining us. I have one. Oh, that's right. You have one.
Thanks, Greg. So we saw already this morning, thank you all for joining us this morning, by the way. I hope that we've seen there are multiple different ways to be involved in medical missions. We've talked about short-term, long-term, clinical, teaching. Now we're shifting gears a little bit and talking about disaster response. But the main thing is all of these principles that Greg introduced at the beginning kind of flow throughout and help us to do everything in a way that glorifies God. So this is about me. Greg said all of this. So for this half an hour, we would like to describe the key standards, resources, and documents available to guide international medical relief work in the area of disaster and refugee situations. So in my presentations, especially these really short ones, I like to go through things quickly and give you a lot of resources and tools that you can use that you'll have to go to and look at yourself. This is a general overview. So per UN OSHA, the number of people in 2019 that were affected by conflicts, extreme climate events, and disease outbreaks was 167.6 million in 1 year. Now, on the right-hand side, the 70.8 million is UNHCR, which is the refugee. OSHA looks at all disasters and conflicts and anything that's affecting people, and UNHCR focuses on refugees. 70.8 million people were displaced worldwide in 2018. This number, the number that everyone, 167.6 million, is about 6 times the population of Texas and half the population of the United States. So in 1 year, over the entire world, half the population of the United States was affected by conflicts, extreme climate events, and disease outbreaks globally. Most of those people we know are children. More than half of those affected and refugees are children. Refugees are displaced to other countries. Internally displaced are displaced within their own country. But this is kind of the global picture of what's happening around the world. And what we want to know is how we, as most of us in this room are healthcare professionals, can engage in that and help in that situation, and how we can do it as Christian healthcare professionals. So we're going to move from the global picture to a personal scenario. And I have a volunteer scribe, who was voluntold, Peter Kwan. Thank you, Peter, for helping. So as I read through the scenario, at the end of it, I'm going to ask you to just yell out things that you're concerned about in this scenario, and I will repeat them so everyone can hear them, and we'll write them up here. So Maria is from a tropical agricultural village in Asia. In the past week, torrential monsoon rains have caused unprecedented flooding in Maria's area, destroying all the crops and displacing Maria and her fellow villagers, along with thousands of their countrymen. What concerns and things do you see that need to be addressed in this scenario? Water. So clean water. Okay.
Shelter.
Diarrhea, diseases, shelter, food. Hold on just a second so we can catch up. Shelter. Food. It's getting to be lunchtime. No. Diarrheal diseases. What else?
Mental health, post-traumatic stress.
Okay. Mental health. Safety. Sanitation.
Family separation.
We got family separation and death. This is a great list, you guys. And we kind of ran out of place. We ran out of space, but good job. We'll get all this up. Family separations. So we have a rule when we do trainings that however the scribe spells it is the correct way to spell it. And death. So mortality. Thank you so much, Peter. Okay, great list. So from some of our resources, which we're going to learn about in this session, and Greg mentioned it, the sphere standards for international relief, this is a slide that they put out about Maria's concerns. So Maria says, I'm concerned about my family and friends. I want to know they are well. So we got family separation. Good job. I want people to come into our community to dress respectfully. I have ideas about how to improve our situation. I want to discuss these. I am a person. I am not a victim. I can help our community life return to normal. I want the information I share in confidence to be managed sensitively. I need and expect a certain level of privacy. I want to know our options. I want to influence the decisions that affect our community in this disaster time. And my religion is important to me. I want to be able to worship. So we went through the main things that we as Western healthcare professionals are priority issues initially, right? And we did get down to mental health, family separation, but there's a difference between our list and Maria's list, right? So what we want to do is see, as Greg introduced at the beginning, how those two lists can come together and how we can meet all of those needs without doing something like this. Who has seen this happen? Who has participated in disaster response? Okay, a handful. So this is the humanitarian responder with the big megaphone saying, wash your hands, boil your water, use latrines, give me that. Or no, the guy says, give me that. So water, latrines, sanitation. And the affected population, the little guy, says, give me that. And he says, better inform us of your intentions, be transparent, help us find our loved ones. Have we seen this happening? Have we seen this happening? Something is better than nothing. I'm in an earthquake zone. I don't have any clothes. Oh, a pink fuzzy bunny suit will do. That will really provide you dignity and help. So how can we prevent this? Well, first we have to look at who are the actors in humanitarian response. So we have the state and local institutions, so kind of like your local government, even your country government, local, national, and international humanitarian agencies. A lot of times we call those NGOs, non-governmental organizations, and the affected population and the community. Again, our question is, where do we, as Christian healthcare providers, fit in, and how can we interact with these? That will be our kind of question throughout. Are there ways to address all of these concerns, our concerns, and Maria's concerns, and these three groups, different groups of actors involved? Are they mutually exclusive? And are there principles and standards that can help us? Well, because we're here at this talk, yes, there are ways to address those concerns. No, they are not mutually exclusive. And yes, there are principles and standards that we want to get to give you as tools to use. But let's take a step back and think, why even participate in humanitarian response? Is there a biblical basis? So take 1 minute to yourself and write down your answer to this question. What's the biblical basis for participating in humanitarian response? Yeah, so at the lunch break, share your ideas with each other. I'm going to share mine with you, but I am sure that you have come up with more than me. So share yours with me too at the break. So the biblical basis, things in the Bible that I see about humanitarian response, Nehemiah to me is kind of like a huge relief effort. Nehemiah going in to rebuild things. We see the story of the Good Samaritan in Luke. Jesus' parable about the sheep and the goats in Matthew, Jesus feeding the crowd and healing, several examples of feeding and healing. So humanitarian response and responding to need. There's also a legal basis and an ethical basis that inform a lot of these resources and tools that we will be talking about. So the United Nations, the Geneva Conventions, there's a Universal Declaration of Human Rights, a Universal Bill of Human Rights, international humanitarian and refugee laws. And in ethics, there's a principle of humanity, that all humans are born free and equal in dignity and rights. And the humanitarian imperative that action should be taken to prevent or alleviate human suffering. So I would contend, as a Christian healthcare provider, that many of the legal and ethical things and the principles that we'll talk about are based on biblical principles and include biblical principles, and we can combine them. They're not mutually exclusive. The Red Cross and then the Sphere organization that we'll talk about in a minute use the legal and ethical bases to come up with their codes of conducts and principles and standards. So I want to go quickly through the Red Cross Code of Conduct because I think it's important for all of us to remember many of these points no matter what we're doing, if we're doing relief, development, community health, teaching. So in relief, the humanitarian imperative that the right to receive and offer humanitarian assistance with the motivation of alleviating human suffering among those least able to withstand the stress is paramount. Aid is given regardless of race, creed, or nationality. I hope we all get that. We all get that in our institutions in the United States. Aid will not be used to further a particular political or religious standpoint. So oftentimes Christian groups look at this and say, well, we can't abide by the code of conduct because we want to share Jesus and share Jesus' love. This is not saying we can't do that. It's saying we cannot say you must accept Jesus to receive our aid. We can give aid and be the hands and feet of Jesus and share his love. We shall endeavor not to act as instruments of government foreign policy, respect culture and custom, attempt to build disaster response on local capacities. So that's a theme throughout the day too. Build on the local capacities. Involve program beneficiaries in the management of the relief aid. Reduce future vulnerability and hold ourselves accountable. So in relief, we're accountable to those we seek to assist, the affected population, and those who are our donors who we're reporting back to how we're doing it. And then in our information, publicity, and advertising activities, we recognize disaster victims as dignified humans, not hopeless objects. A lot of times, the malnourished child who's crying with flies all over them, that gains a lot of attention. We don't always see the other side. We don't always portray the other side of here are the community resources that they're already using to meet that and how we can come alongside. So we've talked about why we participate, biblical, legal, ethical bases for participating in humanitarian response that lead into principles and standards for us to follow. But why do we follow principles and standards? So what are some examples in medicine of principles and standards that we need to follow or that we follow? You can yell these out, I'll repeat them back. Do no harm? Confidentiality. What else? The beneficence is beneficence is to do good, maleficence is to do no harm. We also have academies, institutions, JCO, WHO on the World Health Organization, so on the global level. So in medicine, we have principles and standards that we follow. What are the benefits of having those? We all kind of complain about the JCO surveys, right? But why do we even have them? To ensure quality, accountability. Say that again? Patient safety. So patient safety. Yeah. It also gives us a common language and a way to coordinate efforts among many different people and organizations when we have standards and procedures. Is there a biblical basis? Are there biblical examples of having standards and principles? Or are they just secular? Yeah. Do everything as unto God. Be excellent as I am excellent in love. The sheep and the goats, again, the 10 Commandments. So think about that one and write your answers down about the biblical things for that and share later. So we agree that there are reasons to participate in humanitarian response and reasons to follow principles and standards. So this is what we have been talking about. And I have some pictures of it later, but there is a tool that you can hold in your hands to help you follow all these principles and standards and put them into practice. And it actually is in paper and electronic format, so you can have it on your cell phone, which is called the Sphere Handbook, which is used internationally and widely used and recognized and known, but we don't know much about it in the United States. The Sphere movement started in 1997, actually from humanitarian professionals and organizations saying, we need better quality and accountability in what we're doing. So some of it's both secular and Christian and faith-based, so World Vision, Oxfam. There's 40 to 60 organizations right now involved in the Sphere project. So these are just an example of them. And they came together and wrote the Sphere Handbook. It was collaboratively written. It gives us a common language for all of us to use so that we can all be on the same page. And in 2018, they printed the 4th version. That edition had input from over 1,200 participants in over 65 countries and over 450 organizations. So again, it's quite widely known. But this is where it's in use. And this was a slide from 2016. These were the areas of crisis in the world in that time. And the green dots are where people are using the Sphere Handbook. Where are we not using the Sphere Handbook or knowing about it? In the United States. Where are we using it? Pretty much the rest of the world, maybe a little bit of Europe and Asia, not. And this is who's using it. It's being used in response, after response and relief efforts, but also in recovery and preparedness, so kind of all throughout the cycle, by NGOs, governments, academics, lots of different organizations. Now, the Sphere Handbook, as we'll see, has the principles and how to apply the principles, and then 4 categories of life-saving things: water, sanitation, and hygiene, food, shelter, and health. So all of these that we listed kind of come at the end after we know the principles. But this last category is the health category. What's the lowest use of category? The health category across the world. This was also in 2016, people using Sphere Handbook across the world. So we have a lot of preparation to do. This is the Sphere Vision, a world in which all people affected by disaster or conflict are able to reestablish their lives and recover their livelihoods in ways that respect and promote their dignity. So again, how do we provide relief and aid and assistance and respect and promote dignity at the same time? Sphere core beliefs are people affected have a right to life with dignity, and all possible steps should be taken to alleviate human suffering. So sometimes they seem mutually exclusive, or they don't seem to go together. But what happens when we provide, if we don't alleviate suffering? People die, right? Morbidity and mortality. What happens if we don't protect dignity? We create dependency and paternalism, and it's not sustainable. So the Sphere Handbook has a humanitarian charter with these principles: right to receive humanitarian assistance, right to life with dignity, and right to protection and security. They took the legal and ethical basis to make this humanitarian charter with those 3 rights or principles, and then several different organizations also came together and made a core humanitarian standard, which we'll look at next. The core humanitarian standard is the process standard. It's saying how the legal and ethical and the humanitarian charter, that's why we do. Why do we respond? Then the core humanitarian standard says, okay, how do we take those principles and put them into practice? How do we respond in a way that is amenable with the principles? And then the technical standards are kind of what we do, like the WASH, the medical, the healthcare, the arms and legs behind it. That's a quick structure. So the core humanitarian standard, again, has, what do we notice? Who's in the center? Communities and people affected by the crisis. So our response efforts, we are first accountable to the communities and people affected by the crisis, and they are the first people that need to be consulted. And the commitments are to them as well as to each other and to our donors. The commitments talk about things like relevant and timely, coordinated assistance, focusing on things, avoiding negative effects, the principles that we've talked about throughout the morning. And each of these 9, so it's one standard with 9 commitments, and each of the 9 commitments has actions that you can do to meet that commitment, indicators to tell you that your actions are working and you're meeting the commitment, and guidance as to how to contextualize it. So who has ever written a program or a proposal for any type of humanitarian work or any other work, or a lesson plan or anything? Okay, a few of us. So I didn't know about Sphere when I was the program director of Samaritan's Purse medical projects in Haiti. And when I learned about Sphere 2 years after I left that job, I was like, well, this would have made my job so much easier. This basically writes my whole proposal for me, right? So that's one of my favorite parts. And the other thing is, can you see how this process standard that tells us how to implement things, it meets Maria's concerns that we talked about at the beginning, right? And it leads into meeting our concerns of doing everything, promoting dignity, but saving life at the same time. I want to focus a little bit on one of the tools. Commitment number 6 talks about coordinated and complementary. So UN OSHA, the overall disaster response of the UN, in 2005 came up with a coordinated cluster approach, realizing that humanitarian relief often is not well coordinated, and so now there are clusters. So there's a health cluster, a food security cluster, all the different areas, an education cluster that you might need in a disaster response, and a global agency that would be the agency in charge. So for health, it's World Health Organization. Now, World Health Organization will often, if it is able to, let the Ministry of Health, the local Ministry of Health, really be the coordinating body and the person in charge, and World Health Organization comes alongside and helps so that we're keeping that affected population at the center. In Haiti in 2010, the earthquake hit the capital city. So the Ministry of Health and all of the ministries, Department of Education, were pretty much wiped out. So outside agencies World Health Organization had to kind of take over, and outside agencies did. But when there is that available, we want to identify it. But this is how we coordinate it, and this is how we can connect with those cluster systems. We can register at humanitarian.id, and when we're going to a disaster location, we log in to a humanitarian.id and say we're going to this location, and it will give us the cluster contacts. Now, obviously we want to do this with an organization or a group, not on our own efforts and not going as a cowboy by ourselves, but these are the tools that you can use with your groups. We also have humanitarianresponse.info and reliefweb.int. These 3 websites are from OSHA, the humanitarian.id, and then these 2. These 2 are informational. So humanitarianresponse.info is kind of like a library of tons of humanitarian response efforts going on, and reliefweb.int is a little bit more up to date, to the minute, what you can engage with now. And it gives you all the statistics and what's happening in all of those areas. This is my favorite depiction of the Sphere Handbook. So people's dignity is at the heart. That's kind of where we start. And then the framework is the humanitarian charter, the legal, ethical, biblical basis of things. What guides us is the core humanitarian standard. And then what we do with our arms and legs is WASH, health, shelter, and food security and nutrition. Quickly about the technical standards, they're listed. All of these technical sectors also have standards, action indicators, and guidance notes, and we'll see an example in just a minute. So going back to our scenario at the beginning, this is the essential healthcare, and this is accessible in the Sphere Handbook. We have some books on the back table, and we'll have some at our booth that you can look through, but you can also download it for free online. But essential healthcare, or the health standards, are divided into health systems, because in order to provide healthcare, we need drugs and labs and people personnel, so the health systems, and then the essential health care. Essential health care talks about communicable diseases, child health, sexual and reproductive health, injury and trauma care, mental health, non-communicable diseases, and palliative care. And these are all contextualized for the disaster situation. What do we need? What are the priorities immediately, and then where can we go from there during the recovery efforts? But the first essential healthcare standard is communicable diseases, and the first standard under communicable diseases is prevention of communicable diseases. So again, it's not all about correction and fixing. Yes, we do need to go and stabilize the immediate people, but we always need to have that prevention and long-term aspect in mind too, even in disaster response. The standard is that people have access to health care and information to prevent communicable diseases, and the actions include assessing the situation, how we work with other and coordinate with other sections. How do we prevent disease? By having clean water. So how do we coordinate with the WASH? And then indicators will give you percentage of people who adopt practices, who have access to the health care, who have access to the prevention efforts. Another resource, WHO in emergencies, and I'm just going to go through these slides really quickly, but this is WHO. Now, the WHO came under 5 to 10 years ago, was being scrutinized for not helping that much in emergencies and not really having a lot of up-to-date information, and it has dramatically improved even from when I started doing these talks 4 years ago. So they have updates on what's happening all around the world and how they're involved, and they work more as a coordination and information resource center, but it's really good. And for instance, they have a section on disease outbreaks. So if it's a disease outbreak that's affecting us globally, under disease outbreaks, we have COVID-19 and all of the up-to-date information on COVID-19 or the novel coronavirus that just came out. But all of these, we need to remember, in order to do the technical standards well and in a way that saves lives and promotes dignity, we need to use those together with the principles and the core humanitarian standard that we talked about at the beginning. I have 2 slides of resources. If you want any of these resource slides or any of my slides, you can take my cards that are out there and email me, and I'll send you a copy of them. And that was it for this session. I did want to mention we're having a panel discussion at the end, as Greg mentioned. Please write your questions down. So this is to make you come back in the afternoon after lunch. Please write your questions down for that panel session. And if you don't feel comfortable yelling your question out or using the microphone, we'll have you pass it to the center and I can coordinate that too. But we also want you, the people who feel comfortable, to talk in the crowd, to yell out on the microphone. So, okay, thank you guys.